This course is Pastoral Ministry 401. I'm Steve Googe, your instructor. Today we're going to talk about the art of referral. Inevitably, a minister will find himself over his head in a counseling relationship or a caring conversation. Making referrals is not an isolated act. It is a process which requires skill, time, and sensitivity. Accomplishing a successful referral is complicated. It surprises me that this subject is given only very brief attention in most textbooks and training programs for ministers. We're going to talk on the next slide about what you will learn during this session. In this session, you're going to learn what the verb to refer actually means. Then we will study who to refer, and then how to make referrals, and last, why ministers are resistant to making referrals. On the next slide, you will see Bob Newhart giving us a presentation of what a counseling session should never look like. It will help you know who not to make a referral to. Now let's watch this brief video clip.
Dr. Switzer?
Yes, come in. I'm just washing my hands.
I'm Catherine Bigman. Janet Carlisle referred me.
Oh, yes. Fear of being buried alive in a box.
Yes, that's me. Should I lay down?
Oh, no. We don't do that anymore. Just have a seat. And let me tell you a bit about our billing. I charge $5 for the first 5 minutes. And then absolutely nothing after that. How does that sound?
That sounds great. Too good to be true, as a matter of fact.
Well, I can almost guarantee you that our session won't last the full 5 minutes. Now, we don't do any insurance billing, so you would either have to pay in cash or by check.
Wow, okay.
And I don't make change.
All right.
And go.
Go.
Well,
What?
tell me about the problem that you wish to address.
Oh, okay. Well, I have this fear of being buried alive in a box. I start thinking about being buried alive and I begin to panic.
Has anyone ever tried to bury you alive in a box?
No, but truly thinking about it does make my life horrible. I mean, I can't go through tunnels or be in an elevator or in a house, anything boxy.
So what you're saying is you're claustrophobic.
Yes, that's it.
All right, well, let's go, Catherine. I'm going to say 2 words to you right now. I want you to listen to them very, very carefully. Then I want you to take them out of the office with you and incorporate them into your life.
Well, shall I write them down?
Well, if it makes you comfortable, it's just 2 words. We find most people can remember them.
Okay.
You ready?
Yes.
Okay, here they are. Stop it!
I'm sorry?
Stop it!
Stop it?
Yes, S-T-O-P, new word, I-T.
So, what are you saying?
You know, it's funny. I say 2 simple words, and I cannot tell you the amount of people who say exactly the same thing you're saying. I mean, this is not Yiddish, Catherine. This is English. Stop it.
So, I should just stop it.
There you go. I mean, you don't want to go through life being scared of being buried alive in a box, do you? I mean, that sounds frightening.
It is.
Then stop it.
I can't. I mean, it's been with me since childhood.
No, we don't go there. Just stop it.
So I should just stop being afraid of being buried alive in a box.
You got it. Good go. Well, it's only been 3 minutes, so that will be $3.
Actually, I only have a 5, so
Well, I don't make change.
then I guess I'll take the full 5 minutes.
Fine. All right. Well, what other problems would you like to address?
I'm bulimic. I stick my fingers down my throat.
Stop it! What are you, a nut of some kind? Don't do that.
But I'm compelled to. My mom used to call me fatty.
No, we don't go there.
But I've been having this dream.
No, we don't go there either.
But my horoscope did say...
We definitely don't go there. Just stop it. What else?
Well, I have self-destructive relationships with men.
Stop it! You want to be with a man, don't you?
Yes.
Well, then stop it. Don't be such a big baby.
I wash my hands a lot.
That's all right.
It is?
I wash my hands all the time. There's a lot of germs out there. Yeah, don't worry about that one.
I'm afraid to drive.
Well, stop it! How are you going to get around? Get in the car and drive, you kook. Stop it!
You stop it! You stop it!
What's the problem, Kathy?
I don't like this. I don't like this therapy at all. You're just telling me to stop it.
And you don't like that?
No, I don't.
So you think we're moving too fast? Is that it?
Yes. Yes, I do.
All right, then let me give you 10 words that I think will clear everything up for you. You want to get a pad and a pencil for this one?
All right.
Are you ready? All right, here are the 10 words. Stop it or I'll bury you alive in a box!
The Merriam-Webster Dictionary defines the verb to refer as to send or direct to some person or place, as for treatment, aid, decision, etc. In this broad sense, then, referral is not limited to the helping professionals. It takes place every day between friends, family members, and co-workers for all manner of services. For purposes of this class, we will focus on referrals to those who can help in a professional way. One of the most important ingredients in a successful referral is the minister's own acquaintance with the practitioners to whom he is referring. That is the reason why I have assigned you the opportunity of preparing a referral network directory. You'll find the directory guideline on pages 9 and 10 of your syllabus. Then you will be ready at the end of this quarter to submit a referral network directory. In this referral network directory, you will want to have different people and different individuals to whom you can be able to make referrals. For example, family physicians. If someone asks you for a family physician, who would you recommend to them? There's a place on page number 9 for you to list up to 3 individuals that you could make a reference for. And then financial assistance, counseling services, children's protective services, substance abuse, physical abuse, legal counsel, children's adoptive services. And then there are 2 blank sections where you could list others if you so desire. Now, do you have to have 3 under each category? Well, no. If you have a couple, that would be fine. But 3 would be even better. You'll want to place their address and their phone number together, and then keep this handy, for this could be a great resource for you to be able to use it when you're making a referral. The question should be raised, what do you do when you feel you cannot help a person who has turned to you for help? Statistics tell us that people do turn to their ministers in a time when they need help. So how can you tell them when you are in such a situation that you need to make a referral? you're in over your head, or you don't really have the time necessary to help them, who do you need to refer? We'll look at that on the next slide. Who should you refer? Well, number one, persons who exceed your training. If you realize that you've not been trained to help a person in a particular and specific situation, then refer them. Second, a person who needs more time than you have to invest. 4 or 5 sessions usually are the maximum that I would recommend you seeing a person. For if you develop a long-term relationship, then you're making them dependent upon you. And then number 3, persons who need a specialist. Maybe they need a medical specialist, financial, legal, or psychological specialist. Those with problems for which effective specialized agencies are available in the community need to be referred. On this slide, we continue our discussion of who to refer. Number 4, persons who have broken relationships with us. They should be referred. If we feel the relationship with us might be harmed by our knowing certain things about them, we should refer them. Number 5, persons too closely related to us. That would be family members or even church leaders that we are especially close to need to be referred. 6, persons who view us incorrectly or vice versa. This can involve transference or codependency. If you ever reach the point that you feel like you just simply need to see this individual, and you develop a chemistry with them that could lead to immorality, then close off any conversation with that person, and do it quickly. Don't allow them to view you incorrectly or you to view them in an incorrect way. And then number 7, people who are psychotic. Those who face these kinds of problems may need intensive psychotherapy. Here are some signs of severe mental illness, including the need for a psychiatric referral. Number 1, the person believes that others are attempting to harm him, or assault him sexually, or to influence him in a strange way. A second of these warning signs would be he has a grandiose delusion about himself. A third characteristic, he shows abrupt changes in his typical pattern of behavior. Number 4, he hears voices, has hallucinations, or smells odors which do not exist. Number 5, he has rigid, bizarre ideas and fears which cannot be influenced by logic. Number 6, he engages in a repetitive pattern of compulsive actions or obsessive thoughts. Number 7, he is disoriented, that is, unaware of time, place, or person identity. Number 8, he is depressed to the point of near stupor, or is strangely elated and or aggressive. And then number 9, he withdraws into his inner world, losing interest in normal activities. All these are signs that the person needs psychiatric treatment without delay. We have looked at those people that we need to refer. First is persons whose needs exceed our training. Second, a person who needs more time than we have to invest. Third, a person who needs a specialist. Fourth, a person we have a broken relationship with. Fifth, persons too closely related to us. And sixth, persons who view us incorrectly. Number 7, persons who are psychotic. Refer these individuals and do it promptly. Now on this slide we conclude who to refer to. Number 8, persons who are overtly suicidal. Be sure that you refer those individuals. Number 9, persons who are severely depressed. Number 10, persons who need medical care and or institutionalization. And then number 11, refer those with significant problems with drug use, including alcohol, which is the drug that is abused more in the United States than any other. Refer these individuals and do it promptly, as I mentioned in the previous slide. Now, as promised in the section that talked about what you will learn, we're going to talk about how to refer. Number 1, stopgap supportive help is often an important first step. This helps the person reach that point of being motivated to accept more help in the future. For example, a minister of a rural church has a person who maybe is suffering from paranoid delusions. A referral is essential, but the person may need support for a few weeks before he and his family are ready to seek involuntary hospitalization. Then, number 2, create the expectation beforehand. Make the early part of your conversation with that person cover the subject of referrals. You might say, "If I don't feel I am the best to help you with this issue, I will help you find the best one that I know." One of the most important skills of any person in helping others is the ability to recognize as early as possible those individuals whom one is not able to help, and to refer those people as smoothly and rapidly as possible in the appropriate direction. The person may feel some degree of rejection if it becomes necessary to refer, but if you create the expectation beforehand, it will go much smoother. Number 3, start where that person is in their perception of their problem and the kind of help that is needed. Until the minister understands this picture and accepts the feelings attached to it, he is in no position to make a referral. On the one side, there is the counselee's inner picture of his problem and its solution. On the other, often far away psychologically, is the counselor's perception of the nature of the problem and the help needed. Then number 4, remove emotional roadblocks. You can remove emotional roadblocks with referrals to the particular helping agency that you feel comfortable in making the reference to. Before suggesting that a person with alcoholism go to AA or Celebrate Recovery, it's important to find out how he sees his problem. Ask the person what he has heard and how he feels about the groups. You can do this by using personal experience. And then, number 5, make the referral as specific as possible. Give the names of specific persons, giving at least 2 different individuals to suggest that the person could see. One of the most important ingredients in a successful referral is the minister's own acquaintance with the practitioners to whom he is referring. The minister should make personal contact with several helping professionals in the community, and ideally should pay each one a personal visit. The best approach to take in such a visit is one of honesty and frankness. The minister should not hesitate to ask the helping professional about such things as the nature of his or her practice, general or specialized, their fees, office hours, or the general type of which the helping professional offers. Such a discussion can help lead to a relationship of understanding, trust, and mutual respect, which is the best foundation for a successful referral in the future. So use a stopgap measure to provide support, create the expectation beforehand, start where the person is, remove emotional roadblocks, and make the referral as specific as possible. Now let's take a look at resistance that ministers sometimes have toward making referrals. We have to ask the question, why do ministers resist making referrals? Well, on this slide we will find 5 reasons. Number 1, a feeling of omnipotence. Sometimes we're not willing to acknowledge that we cannot help all people. And it's true, we cannot help everyone in every circumstance. For pastors who have an omnipotence need, referral will be very difficult. Why? Because it's very difficult for them to admit defeat. It would be very threatening to admit that they're not able to help someone in a certain situation. And then second, an inability to diagnose the gravity of a situation. For example, take all suicide threats seriously. We don't have the ability of diagnosing in a clinical way, perhaps, the symptoms that lead us to a diagnosis. But we do have a gut, and our gut feeling helps us to recognize when a person needs to be referred. Our gut feeling will help us understand if we are scared or seduced or being manipulated. And so we can use those feelings to understand when a referral is necessary and then make that referral. And number 3 is our need for approval. Every minister has a need to be approved or affirmed because every person has that same need. And if we allow our need for approval, that we can solve this issue or we can help this individual to overcome our good judgment that we need to make a referral, then that can stand in the way of helping a person. Then number 4, our fear of a lost relationship. We fear that if we suggest a referral, that person may feel rejected and therefore we will lose a relationship with them. Or our fear of offending a person. This is very similar to number 4 that we've already discussed. And then last, number 6, our fear about a destructive referral. It is a fearful thing to refer an individual to a helping professional and fear that will become a destructive kind of relationship. And sometimes that does happen. If you use non-Christian persons who perhaps are in the counseling profession, they often will ridicule the Christian faith. And so that can be a destructive referral, and that helps us to recognize that we need to have a referral network directory listing those people that we feel comfortable referring our church members and friends.